presenters today are Director Scott Bookman, our COVID-19 Incident Commander, and Dr. Rachel Herlihy, our State Epidemiologist. We'll get things started with Dr. Herlihy.
Great, thank you so much. Good afternoon, and thank you all for being here. The news this week is more good news. It does look like we're continuing to see the downward trajectories in really all of our metrics, the same information I shared with you last week. So this figure is showing you case trends in the state. That red line is showing you our 7-day moving average number of cases. And you can see that we continue to see this clear downward trajectory in the number of cases occurring in the state. If you go to the next slide, you'll see that when we look at our positivity data, again, that's the percentage of PCR tests that come back positive for COVID-19. You'll see that we are seeing that same very clear downward trajectory. Again, another indicator that cases and transmission continues to move in the right direction with decreased prevalence of the virus right now. Keep in mind, though, that the levels we're seeing here, both the last slide and the case levels and the percent positivity values we're seeing here continue to be quite high. So while things are moving in the right direction, still a lot of COVID-19 that is circulating in our community right now. Next slide, please. We do also continue to see the downward trajectory when it comes to our hospitalization data. So overall, we do continue to head in the right direction with really all of our measures. So whether that's case data, percent positivity data, or hospitalization data, all of those metrics really trending down and in the right direction at this point. Next slide, please. I want to talk a little bit about the subvariant of Omicron that is known as BA.2. So BA.2 is a type of Omicron. It is known as a subvariant with the main variant that has been circulating known as BA.1. So BA.2 has been circulating for a while and actually has been probably more common in some countries like India and Singapore. But in the last couple of weeks, there's been an interesting phenomenon occurring in some European countries in particular, where BA.2 appears to be replacing BA.1 in some countries. And there's some countries like Denmark would be an example where it looked like cases were leveling out there, but maybe increasing a little bit now. And so because of that, there's questions about whether or not BA.2 may have some sort of advantage over BA.1 and trying to best understand what that might mean for us. So at this point, that fact that BA.2 is replacing BA.1 suggests that it might be more transmissible than BA.1 and could potentially result in an increased rate of transmission, at least for a brief period of time. At this point, though, there's very little information on BA.2 in general, but there is no evidence that it does cause any sort of increased level of severity or any greater level of immune system evasion. So in general, it looks like any impact we see here from BA.2 would potentially cause increased transmission, increase in cases temporarily, but doesn't look like it's that significantly different from BA.1, which has been circulating obviously widely here in Colorado, in the US, and in most European countries. At this point, CDPHE has detected just one case of the BA.2 lineage in the state. That case was identified in late December in the metro area. We have not detected the constellation or sort of the series of mutations that is associated with BA.2 in our wastewater surveillance systems at this point. So we don't believe that BA.2 is widely circulating in Colorado, but we know that there certainly is that potential, and we have our surveillance systems in place to look for it, both with our clinical data and wastewater. And with that, I'll hand it over to Director Bookman.
Thank you, Dr. Herlihy, and thanks to everybody for joining us again today. A few quick updates for me here, and I think our tone from last week carries into this week, which is cautious optimism as we look at cases, percent positivity, hospitalizations, and hospital bed use. What we see here is that our available staffed hospital beds remain stable, and that we see on a 7-day moving average more than 680 acute care hospital beds available. As you see the number of COVID hospitalizations go down, we do also see the number of available beds moving up slightly. Do want to stress there's still a lot of patients in the hospitals with COVID. Our healthcare workforce does still remain under stress, but we are seeing improvements in the total number of hospital beds available in Colorado at this time. Next slide. do want to give an update on our mask program that we've rolled out over the last 2 weeks. And as of today, we have distributed more than 2.5 million masks through this free program. These are medical grade masks, a higher level of protection for Coloradans. And we're so grateful for all of our community partners. We have more than 409 distribution locations. These are libraries, fire departments, and other community centers that have partnered with us to ensure that everyone in Colorado has access to these incredibly important masks. And as I said, we have shipped more than 2.5 million masks at this point and continue to see high demand. For those who are interested in getting masks through our program, I encourage people to go to our website, identify a specific site near them, figure out what their hours are, and then go and get your free supply of masks. Next slide. And finally, continuing to let all Coloradans know the importance of staying up to date on our COVID-19 vaccinations. So parents and guardians of 5 to 11-year-olds should make a vaccination plan. And it is absolutely critical that we stay up to date to have the highest level of protection against COVID-19. So for those who are 12 and up, they can get a third dose of their Pfizer 5 months after they've received their second. For those who are 18 and up, you can get a third dose of the Moderna after your second, 5 months after your second dose. And then for anybody who's 18 and up, you can get a second dose of your J&J if you're more than 2 months past getting your initial dose there. We're really proud in Colorado that more than 36% of children 5 to 11 have received their first dose. This exceeds the national average. And also 27% of 5 to 11-year-olds are fully vaccinated against COVID, which also exceeds the national rate. For anybody who needs more information on how to access these incredibly important, free, safe, and effective vaccines, please go to our website to find information and where you might find a provider who can give this vaccine for free. I think, Brian, I turn it back over to you here.
Great, thank you, Director Bookman and Dr. Herlihy. We'll go ahead and open it up for the media Q&A portion of this afternoon's avail. We'll use the raise hand function. You can locate that at the bottom of the Zoom console. Let's start with first questions first. Time allowing, we can come back for some second questions or follow-ups. Please state your name and your outlet before asking your question. And if we aren't able to get to your question or you have any other questions that we were not able to get to today, media_info@state.co.us is where you can reach us, and we'll get back to you as soon as possible. Let's go ahead and start with Erica Meltzer.
This is Erica Meltzer from Chalkbeat. Thank you for taking our questions today. We've heard, or we've seen a number of school districts in the last week announce that they're, for example, suspending contact tracing because they just have too many cases and they can't keep up. Seeing school nurses raise concerns that some of the protocols that have kept children safe are breaking down. And I'm curious, do you feel like you have a good understanding of what's happening in schools right now? Do you feel like the outbreaks being reported to the state website are accurate, or that you're missing cases because of some of these breakdowns in schools no longer contact tracing?
Yeah, I can take that question. So anytime when we see really high rates of disease transmission, we know that our detection rate goes down, and that's really in all settings. We know that when the large volume of cases occurs, there is stress certainly on our systems. We also know that with Omicron, we're potentially seeing milder illness, especially among fully vaccinated individuals. And so that can result in individuals potentially not necessarily being tested for COVID-19, having asymptomatic infections. We know it's much more difficult to detect those asymptomatic infections. So I think there's probably a variety of things going on right now that leads to overall decreased levels of detection. We're certainly continuing to work closely with our local public health partners and our school district districts to ensure that we have all of those layered strategies in place to continue to make sure our schools are as safe as possible. Also working on updating access to new testing strategies in the state. So lots of work underway to really make sure that we are trying to keep our schools as safe as possible.
All right, let's go to KDVR Digital.
Hey guys, Alex Rose here with Fox 31. Yesterday, CDPHE put out a press release saying immunity to Omicron is high and rising in Colorado. The modeling estimates that 80% of the state's population will be immune to Omicron by mid-February. Dr. Herlihy, I'm just hoping that you could touch on that modeling report, kind of briefly explain what went into it, and also how natural immunity factors into that modeling as well. Thank you so much.
Sure, absolutely. So you're right. Our modeling team did update their modeling work and put out a report yesterday that the findings of that modeling report are very consistent with what we are seeing in our surveillance data. So very similar to what we're seeing with really positive trends in cases, percent positivity, hospitalizations right now. As you mentioned, they did report that they think currently about 75% of Coloradans are immune to Omicron. They think that by mid-February, that number will get up to 80%. And similar to what we've been sharing with you, they are feeling cautiously optimistic that the next few weeks and months could potentially result in much less COVID-19 transmission than we have seen recently. But also they do highlight in their report that of course depends on the not seeing a new variant emerge. Obviously, we know that a new variant emerging would certainly change the story, but that high level of immunity, either through infection or through vaccination, does leave us in a very different place than we've been previously in the pandemic. And again, hoping that translates to at least a period of time where we have much less COVID-19 transmission.
All right, let's go to Sarah Flower.
Thank you, Sarah Flower here with KDUR. I see that is cautiously optimistic throughout the state, but down here in Southwest Colorado, our positivity rate in neighboring counties are up to nearly 30%, if not more than. This information, I guess, is just not equitable. And if you could talk to that for these rural areas that are still struggling with their high positivity rates. Thank you.
Yes, so I would say that first, positivity remains high across the state. And so when I say that we are feeling optimistic about the data, I'm feeling optimistic about the trajectory of the data, this downward trend we're seeing. But throughout the state, we're continuing to see really high case rates, really high positivity rates, and really high hospitalization rates. They're just moving in the right direction. We know that different regions of the state, as they have throughout the pandemic, have moved at different rates. And we have seen that decreasing trend earliest in some of our mountain resort communities in the metro area. It is certainly spreading out from that, and we have some good visualizations on our website that show you where rates are decreasing more quickly right now. But some of the places where we are not yet seeing that clear decreasing trend would include Mesa County, and then, as you mentioned, some of our southern regions in the state are places where we really haven't yet seen that clear turn of the corner into a downward trajectory. But overall, the numbers in the state are moving in that direction, and I do expect that those regions of the state will move in that direction soon, but are lagging behind. And that's really because their Omicron surges started later than Omicron surges, in other parts of the state.
All right, let's go to Meg Wingert.
Hello, this is Meg from the Denver Post. I had a question about the hospital bed numbers. When I've been looking at it on the state website, it looks like we're still kind of stuck around that 92, 93% full, even though the COVID hospitalizations have been going down. So I wondered if that's just, those beds are now being used for other things that were maybe being put off, or if we're continuing to see the supply of beds decrease because of the staffing issues.
So, Meg, I think there's a number of factors that go into this. And, number one, we do know that there is still an impact of delayed care over the course of this pandemic, and hospitals have been delaying procedures to ensure that they're using their staff and their bed capacity to meet the demands of those who need it the most. And so we do hear that as discharges of COVID patients increase, that there are other patients who are immediately going in to fill them for procedures that have been delayed and they're now catching up on. We do also know, as Dr. Hurley indicated, rates of COVID in the state are still very high. While they may be coming down and all heading in the right direction, there is still an impact on workforces across the state and across the country, not just specific to hospitals and to the healthcare system, but that does also have an impact on that bed availability.
Let's go to Hernandez.
Hi, this is Esteban Hernandez with Denverite. So Denver's indoor mask mandate expires next week, and I understand the city has passed its the Omicron peak. But Dr. Hurley, do you have any recommendations for the city on whether they should extend the indoor mask mandate beyond February 3rd?
Sure. So what I can speak to as our state epidemiologist is the fact that we do continue to see high levels of disease transmission. As I mentioned a couple of minutes ago, while we have turned the corner and we're seeing these positive trajectories with downward cases, downward percent positivity and downward hospitalization numbers, the number of infections that are occurring are still quite high. And I think it's always important to keep in mind when we think about an epidemic curve is, we go up, and when we get to the peak, that means we're only halfway there, right? So we still have quite a number of additional cases, hospitalizations yet to come. So numbers continue to be high. I don't know if there's anything else you want to add to that, Director Bookman.
Yeah, I would just add in that, we are the state health department. All of our counties also have local health departments who are advising their local elected officials on the right mitigation measures at the right time for their communities. And so, we are always here as a resource for our partners, but also have incredible confidence in the city and county of Denver, their health department, to make the best decision for their community under the local control within Colorado.
Great, let's go to John Daly.
Hi, just wondering, I think this may be a question more for Scott. Wondering if you could speak to where things are in terms of crisis standards of care. Do you anticipate kind of status quo for now, where they would continue to be in effect for staffing and EMS, but not going into effect for hospitals in general?
Well, John, there's certainly no indication that we need to move forward with crisis standards of care for hospitals at this point. We are seeing, all of these numbers go very much in the right direction. And with that, we continue to evaluate on a daily basis when we can remove those crisis standards of care for staffing and for EMS. We're 2 years into the pandemic now. We want to make sure that we are keeping things under normal conditions as much as humanly possible. So we will continue to evaluate these metrics, and as soon as we can, we will back away from those crisis standards of care.
Let's go to Deb Stanley.
Hi. We had an awful lot of people who got vaccinated last year in February and March. We're coming up on a time when those people are 10 months past their second dose of vaccine. What is the definition of fully vaxxed in Colorado?
Sure, I can take that on. So CDC actually has some pretty clear definitions. They recently came out with a new definition that talks about individuals being up to date on vaccinations. And up to date basically means that you have received all of the vaccinations that you are eligible for. So for adults that have received 2 doses of vaccine and are eligible for a booster dose, that means they've received that booster dose of vaccine. And we know that having received that 3rd dose or booster dose is really what's going to provide you the greatest level of protection against infection and against severe disease. So certainly urge individuals to receive their booster doses. And of course, booster doses now eligible, our children now eligible for booster doses as well. So really being up to date is what is going to provide the most protection.
Does the state have any requirements on boosters?
At this time, I do not believe we have any requirements around boosters. Scott, please weigh in there if you think.
No, we have not added any requirements around boosters. We're still gathering information, about where the CDC is headed with this. This is a continually evolving pandemic. And as we learn more, we will make the best decision based on what federal guidance we receive.
All right, let's go to Vinny.
Thank you.
Hello, thank you. This is Vinny Del Giudice at Bloomberg News in Denver. This is for Dr. Hurley. And doctor, please be patient with me because I got a C- in college biology, but I want to make sure I understand this. You've detected a single case of the COVID-19 Omicron BA2 subvariant in the state, and it can spread faster. You found it in the Denver metro area. I did some research while you were talking, and I see Denmark, where it's been a problem, says it can spread about 1.5 times more than BA1. Is Colorado the first state in the United States? And again, being I was a C- student, did I get my facts right? Thank you very much.
Yes, I think you got your facts right there. We have at this point just seen that one case so far in Colorado, but we are actively looking for others. And there are a number of states and jurisdictions in the US that have identified small numbers of BA2 cases as well. I'm not aware of widespread transmission in the US at this point.
All right, let's go to Jesus Sanchez Malin. Jesus, are you with us still? All right, let's go to Rick Salinger.
Hi, it's Rick Salinger with Channel 4 in Denver, and I think I got a D in biology, but that may have been in conduct. Anyway, that is very good news, what you say about the downward trend on the numbers, even though the case numbers and positivity rate remains very high. My question is for Dr. Hurley. What would you say to those who have gotten ill with the Omicron virus? Are they in the clear now, or could they catch it again?
Yes, that's a great question, and actually a question that we are asking right now as well. We don't have great data about Omicron reinfection, meaning that if you've had Omicron, what your risk is of being reinfected with Omicron, or perhaps whatever the next variant that comes along might be. And so that's obviously something that we would like to learn much more about. We know that probably short term there is good protection, but what we don't understand is as you get further and further out from that Omicron infection, what your level of protection might be, or your level of immunity from a prior infection. So we know that the greatest protection is going to come from vaccination. So certainly encourage individuals, even if you have had an Omicron infection, if you have not received your third dose, certainly encourage you to do that, because that's really what is going to provide you the longest lasting protection and the greatest protection against severe disease.
Great, let's try to go back to Jesus.
Hi, how are you? I need to know to what extent it is possible to know how many people that death was unvaccinated.
Sorry, could you repeat that question? The number of
people unvaccinated that have death, or the proportion of people who have death by COVID who were not vaccinated.
Yeah, I think we would have to get back to you on those specific numbers. I don't have them in front of me, but we certainly do see much higher rates of mortality occurring among individuals that are unvaccinated versus individuals that are fully vaccinated. And then certainly when compared to individuals that have received booster doses, that's really where we see the greatest level of protection. I'd have to get back to you though on the specific numbers.
Jesus, I'll be happy to follow up with you after the press conference via email with some of that information. Let's go to Seth Klayman.
Hi, Seth McZett, thanks. Scott or Dr. Hurley, can you guys speak to antiviral access, what that's going to look like over the next couple of months, shipment-wise coming to Colorado, and how distribution is going to work statewide? Thanks.
Seth, great question. All of the therapeutics for COVID continue to be managed at the federal level. The United States government has, purchased significant supplies of these medications, and they allocate them out to the states on a per capita basis. And right now, supplies remain incredibly small. We received 300 odd doses of the single monoclonal that works right now for the entire state per week. We're receiving about 900 doses of the oral therapeutic Paxlovid. And so, these continue to be incredibly supply constrained right now. We have heard that there will be more federal supply coming in over the next several months, but in the coming weeks, there won't really be any change to that. And so for now, the supply is really constrained, and it's up to providers to make sure that they're advising their patients who would meet the qualifications of being at high risk for hospitalization to receive this medication.
All right, any other first questions in the room? All right, let's go back to KDVR.
Alex again with Fox 31. Looking at state data, currently 35% of people in the hospital right now are considered fully vaccinated. So we've never seen a larger share in the data of breakthrough hospitalizations. I'm wondering, because we also know that incidental COVID, those rates have never been as high. So I'm wondering, at what point do we need to kind of clarify some of this data? Because it's been a talking point, right? That a vast majority of our hospitalized population are among the unvaccinated, but that share is starting to change. So at what point do we clarify this, and what kind of a factor does incidental COVID play in all this? Thank you.
Yeah, great question. And we certainly are interested and have been analyzing that reason for hospitalization data and sharing that with all of you as well. We're continuing to look at that data and look at different ways to analyze it. But you're absolutely right that I think both, there are some differences with Omicron that have resulted in greater vaccine breakthrough, but also that really high background rate of infections we're seeing. That really high prevalence is resulting in a higher proportion of hospitalizations that are among people who may not necessarily be hospitalized due to COVID-19, but with COVID-19. And so there are some distinctions there, and we'll continue to share that data with you as we continue to analyze that and really have greater clarity. As I've mentioned previously, the challenge with some of that reason for hospitalization data is that it is coding data that comes from, from billing processes at hospitals. And so we don't get that data until patients are discharged from the hospital. So it's not available in real time. It takes a while for that data to get to us, for us to analyze it and interpret it. It's different than the other types of data that we have, where we can, the day we receive it, produce figures and data and share it with you. It takes more time than that, unfortunately.
All right, thank you everyone for joining us this afternoon. If there are any questions that you have after we wrap here, please feel free to email us at media_info@state.co.us, and we'll get back to you as soon as we can. Thank you, Director Bookman and Dr. Herlihy, and thank you all for joining. Have a good afternoon.